I'm here with my beautiful patient today. We're doing total facial sculpting with neurotoxin and filler. And so we're gonna start with a facial analysis for her. So you're young, you're beautiful, she's got great skin. You can see when you smile, furrow your brow, raise your eyebrows. We're gonna soften those lines, lift the brows for an eye-opening look, and then we're going to sculpt her cheekbones and jawline, as well as on the profile view, straighten the nose and address this small little bump that we have, and hydrate the lip. We also have the earliest signs of some volume loss at the temple. That's an often overlooked area, but it's one of the signs one of the earliest places that we show signs of aging. So that's what we're gonna do for you today. How do you feel?
Great.
Okay. So I want you to lean your head back and relax. So I'm going to start first with marking the cheekbones. I like to mark where the malar fat pads are, the cheekbone highlights of the zygoma. I like to draw them a little bit higher than where they actually are because we want to lift or give a lifted appearance to the face. Obviously, we're not actually lifting the face, but we're gonna change the way that the light strikes it. When I look at the jawline, I'm marking the pre-jowl sulcus. We're gonna fill that in to straighten it, and we're gonna soften this natural chin dimple she has. So on the profile view, that's gonna look really pretty. All right, I want you to go ahead and furrow your brow for me. Marking muscle movement, raise your brows. Smile around your eyes. And relax everything. All right, so we're gonna start with the nose. Non-surgical rhinoplasty, it's all about camouflage. You can only do reductive measures through surgery itself. So in this case, we're gonna augment above and below the bump that she has and make that disappear. And I'm going in the supraperiosteal plane. You can see already how much straighter that looks. People like a nice little super tip break, which she has. I'm gonna turn up her nose just a little bit, but she's got a really pretty tip, so nothing too extreme there. And kind of accentuate those really pretty features that she naturally has. If we look at that, I'm gonna add just a little bit more here and soften the break. You're doing beautifully. And when done properly, since we keep the filler very midline, this is not going to widen the look of her nose. If anything, it will narrow it. And she's already got a fine nose, so I'm gonna make sure that I keep my filler placement wide enough so we don't make it too thin. So that's her non-surgical rhinoplasty performed, and you can see just how different her profile view is now compared to before. It's like her bump magically disappeared. You look great. How are you doing? So again, for cheek filler, we're going into the deep plane. We want to be right in the malar fat pad. That's also a safe place to inject. And what I'm looking for is to see a softening in the prominence of that orbicularis retaining ligament, which is what we're really seeing here, that crease. She's not someone who I would consider deficient in the tear trough area. Some people would think that's where she needs placement. But if we actually just support her malar fat pads, we're gonna see that shadow completely disappear. So you're a beautiful candidate for this procedure. Always moving my needle, small aliquots. I'm gonna make you match on both sides now. Some patients, after we do this, will still have deficiency in the tear trough area. At that point, once you've supported the cheek, then we can feel confident about adding more volume in the tear trough area and know that we're not overdoing it. And a little bit more right here. Okay. Beautiful. So what you can see now is we've completed some filler in the malar fat pad area. And even though I put a little bit more on this side than this side, you can see that it's normal to have differences in volume loss from one side to the other. Our faces are not symmetric. So I'm going to add just a little bit more here so that we can really make that crease disappear. This side I would consider complete. Then we're gonna go along and build up the cheekbone and create a nice highlight where the light strikes your face. So now I'm gonna build some volume along the cheekbone. We're trying to raise where the light strikes the face. So this doesn't actually lift up the soft tissues of the face, but it is gonna change the high point, and that's where the light strikes. So just like a makeup artist would contour with a highlighter in this area and put some shadows beneath it to move it up, we're gonna do that in real life with filler. And it's just a really small amount for her. She's young, she's got beautiful features. And we're injecting deep here with my needle moving, so we just have a small, thin, continuous line of filler across the face. And if you go back to the center now, that looks beautifully rejuvenated. So my goals for her are to fill in the shadowing that we have in the pre-gel sulcus, bring out the chin a little bit to better balance her nose. She's got a beautiful, strong nose. We're gonna create a little bit of a stronger chin for her. And then we'll complete this with a lip and some Botox injections at the top. And what a beautiful, beautiful view. And change to the profile here. I ask my patients to give about a week or two to really let everything settle in, the swelling to come down, and then they can fully assess all the changes we're making today. A little more filler. Again, deep injections to periosteal plane. That's safe and also really important because we want her to look great dynamically, not just statically. So it's really, really important to know that when she smiles and her face moves, that she doesn't have a superficial ridge of filler that will move up and down. So you'll see some of that sometimes. So you have to make sure that you keep the injection deep and close to the bone. then I like to just mold. I pinch along the jawline so we make this nice and sharp, because that's what everyone wants. Razor sharp jawline. Okay. So temple, we're looking for where the shadowing comes in. That's gonna be in this area here. Again, you wanna stay deep. You wanna keep moving your needle, low pressure, because that's considered a higher risk area where there's a number of veins. So if we do that, very, very safe. In this area, it's really, really important to massage. You're always gonna see a little irregularities right after you do the injection. And then I will massage it, and then I also ask my patients to massage it afterwards too, so that everything ultimately looks nice and smooth. And these are all hyaluronic acid fillers that we're using in your face. I think that's really, really important. You always need to know from a safety perspective that you can dissolve things in case you inject into a blood vessel. Now I'm gonna do your other side. And again, massage really important in this area because you're always initially gonna see it, but by the end, just with really firm pressure. And I'm known for being a firm massager, which is what you're feeling right now. All of that will dissipate, and you're gonna continue to massage that over the next couple days. You always want to go back and look and adjust for symmetry. So again, just like we were saying with the cheeks, no temple will be the same on either side. And so it's always a good idea to go back, do what you think, and then you're going to adjust what you've done. Neurotoxin injection now. So go ahead, furrow your brow for me, make that angry face, squint around your eyes. So these are the muscles that depress the brow. So we're going to be more aggressive in our injections here. That's gonna give an overall lifted effect by softening the active depressors. And then we're just making sure we're not doing too much injection into the frontalis muscle of the forehead because we don't wanna give her a heaviness to her brow. You're young, you're pretty, you wanna keep everything nice, light, and fresh. So go ahead and lean back for me. And we're gonna start with the orbicularis muscle, which creates our so-called crow's feet. So this is gonna simultaneously treat and prevent crow's feet wrinkles in here, or wrinkles of the periorbita. Turn towards me, while also simultaneously lifting the tail of the brow. And neurotoxin injections, we're not gonna see the effect of that for about 2 weeks. Important to inject deep into the corrugator muscle here. This is not a superficial injection. Orbicularis is right under the skin, so you can inject that superficially, but this one needs to be deeper. Same thing with frontalis. I try to just nick the skin. The muscle is right there, and going shallower helps prevent, in my opinion, bruising in these areas, although it certainly can happen with any injection point. Okay, you've got beautiful natural lips. We've got a beautiful Cupid's bow. So for her, we want to maintain those features. We also want to make sure that she looks very, very natural afterwards. We just want to see that her lip looks hydrated, a little bit plumper, but we want to make sure that she maintains, and then on her profile view, just a nice gentle slope. This is not a duck lip, so we're gonna add a little bit to her filtral columns too at the end, and a little bit to the commissures, oral commissures, or corners of the mouth to support the newly augmented lip. So this should look very soft, very natural. It should not appear like she's had lip filler done. So and yes, these are very sensitive and you're doing very, very well. The artery runs suborbicularis oris, so you want to stay superficial enough, but you don't want to see the filler as you go in. Oh. And there's two of these. You're doing great. Okay, beautiful. We don't have to do that again. And we're filling up those two lip pillows, keeping most of the volume central, and create that really pretty pout. Blend it out. I always pinch at the corner of the Cupid's bow, then out to the sides, and I have patients do that too. Same thing for the bottom lip. So I consider this a subtle lip, and I put most of the filler on the vermilion itself, but we are gonna do a little bit of fencing to create a little bit more drama in the center of the mouth. Not too much, just a little bit. That looks so pretty. Go ahead and smile for me, really big. Great. And I like to do that and relax. Check for symmetry. So I can see I need to add a little bit more to her bottom lip. And this technique builds more vertical height. So beautiful. I think that's it. So what we've done here is a beautiful facial sculpting. It's changes of millimeters. These are not dramatic changes. You're young. We're just optimizing her face. And so it's all about ratios and balance and proportion. So we have straightened the nose, lifted the tip, straightened the jawline. She's got a stronger nose, so we brought out her chin to match. Gone for a hydrated, youthful, plump lip, filled in the temples, sculpted the cheekbones, and especially once everything settles and the prick marks goes away, you're just gonna look like this nice, beautiful, fresh version of yourself.
Thank you so much.
You're very welcome.